Hi everyone. So during my shadowing experience, I went to Phoenix Children's Hospital, and I had the opportunity to talk and learn from the P4 student. She was completing her rotation, and they specialized in ambulatory care, like an asthma clinic. And this experience gave me a really good look into like what it's like to practice as a pharmacist, in a clinical and patient-centered setting. So in this area of pharmacy, there's a lot of like direct patient care, and then the pharmacist works one-on-one with children and their families, to help like manage asthma, and like other chronic conditions as well. And it's not just about like adjusting medications, but it's also about like listening to the patients and educating the families, making sure they really feel like heard and supported. And it takes like strong clinical knowledge to be this type of pharmacist, but also like really good in communication and people skills. And it like needs that to build trust and to connect with the patients, especially like with pediatrics. So the pharmacist week is pretty structured, but it also is like very diverse. So on Mondays and Fridays, the P4 had mentioned that they work on projects and they prepare patients for like upcoming clinical visits. And on Tuesdays, they basically spend that day reviewing patient cases for the next day, which is Wednesday, which is when they have their asthma clinic. And it's like one of the busiest days of the week for them, are Wednesdays. And then the P4 also said that Fridays are just also for projects, and then she also did presentations and she discussed different disease states. And then the pharmacist's main duties include like working in the asthma, and then there's also a clinic for diabetes. And then they do like administrative work, they collab with providers, and they to help like support students, learners, and also like to work in this type of setting. It also does need additional training, like that's required. It's usually like a 1 to 2 year residency in ambulatory care after pharmacy school. And she had mentioned that programs like the VA are known to be great options for this path, because it can like easily allow you to get into it. And then the P4 student that I shadowed, she was really involved in patient care and learning, and she helped their preceptor with like projects and reviewed patient charts and managed like post-care for asthma patients to determine if like their incidents were preventable. So I actually did get to see her like make phone calls and asking the parent of the child a lot of questions about how they developed it and stuff like that, to see, because they do get like visits and appointments, like if the child, something wrong goes with them, they want to see if that's like preventable, if they took their inhaler correctly or any of their medications. And then their typical day, it's like it ran from 8:30 to 4:30, and it's just filled with like patient cases, topic discussions, and like helping the pharmacist with the daily workflow. And they also really help the doctor a lot. Like they help the provider a lot because their day can be really busy, so the pharmacist really helps like manage their time. And when I asked the P4 student if she liked working in this setting, she said absolutely yes, like especially because they love the clinical environment and how rewarding it feels to like see patients improve. And their advice for rotations for me was to always keep an open mind and just stay positive and show respect and like put in the effort, which was the main thing. And they mentioned that every rotation is like a valuable learning experience, and it could even like open doors to future job opportunities. So yeah, but overall I really enjoyed my experience at Phoenix Children's Hospital. It was inspiring to see like how pharmacists can make such a meaningful impact on like children's health, especially managing like chronic diseases like asthma or diabetes. And it's also helped me understand like how much teamwork and communication goes into providing like quality patient care. And I think I would really enjoy doing an API rotation at a site like this, just because it combines like everything I'm interested in, such as like clinical problem solving, the patient interaction, and also collaborating like as a healthcare team. And this experience definitely made me more interested in pursuing ambulatory care pharmacy in the future, especially in a setting where I can make a difference for patients and their families every day. Thank you.